It has been just over a year since the Congress pushed through a comprehensive health care reform bill implementing vast changes to the way that Americans will get medical insurance and putting dozens of new regulations on the healthcare industry. Now, as a part of that plan, states are required to set up what's known as healthcare exchanges for a small portion of the population, and that's mainly the unemployed or those who work at small businesses or self-employed people who just don't have insurance at this moment. Now, how these exchanges will operate is still unclear because many states are just now starting to look at how they will implement the federal mandate. My next two guests actually met with state officials just today to talk about this. It's very complex. Russ Chandra is the Director of Advocacy at the American Cancer Society. And then also joining me is Neil Lane. He is an Executive Council member at AARP. Thank you very much for being here.
Great to be here.
Thanks, both of you. So I should say this, now, and Russ, you and I have actually spoken about this before, and I feel relieved that the state is actually talking about this, the Cuomo administration is, because if they were not, we would be perhaps foregoing millions of dollars of Medicaid funding, and that's a problem since we just cut $1.5 billion in Medicaid.
Well, it wouldn't be Medicaid funding, but the Affordable Care Act provides for millions of dollars that's available to the states to help them with the process of setting up these exchanges, which are going to require hiring staff and buying a lot of IT equipment and that type of thing.
So it's like a block grant? Is that how it comes down then?
Well, no, I wouldn't say it's a block grant. No, they have to write a proposal. But they can't do that until they have, I mean, what the feds have said is, you know, you become eligible for this money once you have established an exchange that we can give the money to so that they can use it for this purpose.
Neil, can you explain what an exchange is exactly?
Well, in very broad terms, because it's really just being imagined as we speak. In fact, there are many federal regulations that relate to the exchanges that are not even written yet. But it is to be a central point of access for any person who needs insurance, whether it's public benefit like Medicaid or whether it's private insurance. It's a point of entry, if you will, into the insurance market. And that's the broad scheme of things. There's a lot of particulars around that.
It's a marketplace or a bazaar, basically, where people can come to buy their health insurance.
But would you bid on health insurance?
No, and this gets to how, you know, to some of the functions of the exchange. First of all, there will be an essential benefits package that every plan will have. Then there will be plans will have different amounts of benefits to them, you know, higher copays, lower copays, deductibles, that type of thing. And they will be scored by the exchange, and they'll be classified platinum, gold, silver, bronze, with, you know, bronze obviously not offering as much in the way of benefits, but costing less. So people will go to the exchange, and it's going to be done largely, I think, you know, online, although there will be brick and mortar places where people can go as well. But you'll go online, you'll look at the different plans, you'll decide what you want to spend, what, you know, your family's needs are, and then you'll be able to select your insurance.
But the threshold issue here is, of course, that you have to have insurance. That's what this is all about, right?
That's correct. There are very few New Yorkers that would be exempted from having health insurance.
And we're talking about 3 million people who are not insured right now in the state.
That is correct.
Okay, the idea is that there would be some kind of competition, right, in said bazaar that would enable people to have affordable health care insurance. That's what we're hoping here.
Yeah.
I mean, obviously this is quite complicated, and you guys met today with the administration, and it seems to me like the more that you're going to be meeting, the more questions there are to be answered.
Oh, certainly. The devil is always in the details, and you know, I mean, and there are several models, if you will, for a bazaar, and one is just an open floodgate, if you will, for any insurer who meets basic requirements, who wants to list their plan. And then there is...
And actually there's an example of that now in existence. The state of Utah set up such a thing.
Well, how's it working?
It doesn't.
Right.
Okay, well, that's a problem.
Yeah, I mean, Utah has something like 250 or 300,000 uninsured people, and something like, last count, 2,200 had gotten their insurance through that exchange. So that one's not
So
working.
that's a pretty small number.
Okay, but what are some of the concerns, for example, of AARP who have, and now, I mean, many of your members are on Medicare, for example.
Yes, but first to be, for example, we have members beginning at age 50. And I think it's important to say that we're a mission and driven organization who has members. That's different than a membership organization, if you will. So the mission is advocacy and quality of life, particularly, certainly in healthcare. So we have about 30% of New York's uninsured populations are the population between 45 and 64.
I see.
So that's a large group of our membership rate in that cohort. And many of our members are employed in small businesses in New York, and that's another cohort that needs to have access to insurance.
And is there also some question from people like you, Russ, who would be worried about what is and is not covered in said plans that reach that threshold of getting accepted into the bazaar, if you will?
There will be an essential benefits package mandated by the federal government that we expect to come out this summer. So there will be a kind of a floor. Now, we do want an exchange that is very active in helping to increase the benefits that are available to people and also to bring down the price. And the way the exchange can do this is by getting more and more people into the marketplace, aggregating people into larger and larger buying pools.
Okay, this is all taking place at a time when there's a discussion at the federal level among Republicans of defunding healthcare reform altogether. We expect that that's not going to happen because, of course, the president signed it into law. He's not going to he's not going to sign a defunding of his own healthcare signature piece of legislation.
Right.
However, there's also a discussion about Medicare and Medicaid and changing the way that these entitlement programs work. And while I do believe that the president has said that he is going to protect them, not in their current format. So how is that going to play in to this discussion that we're now having about who's insured and who isn't and how those people get insurance?
Well, really, both Medicaid and Medicare are part of the environment that the exchanges work in. We expect Medicaid to be pretty well integrated into the exchange so that when a person goes to the exchange, they put in their, information about their income and that kind of stuff. If they're Medicaid eligible, they'll just go into the Medicaid plans.
Okay, but that could increase, theoretically, that could increase the number of people who are getting Medicaid in New York when we've already been cutting the amount of funding that Medicaid...
And I would expect it will.
Okay, well, isn't that going to be problematic then?
I think if you look in terms of dollars and cents, I think it's going to be another challenge. But the challenge for New York's Medicaid program is far beyond increased enrollment. It has to do basically with the aging of our population in a large sense. And
well, that's a Medicare question then, isn't it?
Well, it's also Medicaid.
Not when you're in a nursing home.
Right. Well,
point.
there are
Right.
many. The most expensive Medicaid customers in New York State are what's known as dual eligibles.
Right.
That means they have both Medicare and Medicaid. And these are the most costliest patients by far.
Okay, let's just back up for a second. In terms of these exchanges, there needs to be legislation that is passed ideally this session, correct? And we're going to see the end of the session in June, so we
That's
don't
right.
have a terrible amount of time here.
Right.
Mm-hmm.
And this is the first that I'm hearing of a real meeting at
Right.
the administration. So are we late to the table on this discussion?
Well, that's not an easy, there's no easy answer to that one. Certainly other states have acted ahead of us. But there are plenty of states who have not yet acted, who will do an exchange. And then there are some states that are choosing not to do an exchange and have the federal government run it.
Okay, but if we do not, so that's an option if we do not pass the legislation, but it does
That's
not seem...
an option.
It's
Not
not
for
an
New York.
option?
Not for New York.
Okay,
No.
so if the ideal situation is that there will be some kind of legislation that will at the very least set up the governance issue.
Yes.
What kind of exchange we're going to have, if it'll be a nonprofit, if it will be run by some kind of authority in the state, correct?
That's the method we prefer, rather than
authority.
putting it into an existing department like the insurance department.
Okay. And then beyond that, do you expect that the legislation that we may or may not see at some point, is there a timeline for it right now, coming out of this meeting?
Well, in the meeting, I thought they were pretty clear. They recognize that they need to get this done by the end of the session. The question is, how many of the other major decisions can we defer? Is it, do we need to defer? Is it preferable to defer until after, June?
Well, in other words, what is the bottom threshold that you need to get the federal government to accept your plan and sign off on it and let the money start flowing so you can get the exchange off the ground? Is that right?
Yeah,
That's precisely the case, because as we mentioned earlier, they have to have an entity to provide the funds to, and that has to be established in legislation.
Interesting. Okay.
Now,
So
there are other things that we would like. I think
yeah.
we have very strong ideas on
Right.
different things. What the exchange should do and how it should be structured, and how many exchanges there should be.
Right.
But whether we can do that before the end of June, I think, is a big question. There's probably a few key items that will at least make a run at getting into the statute that's enacted this year. But if we don't, then it's deferred, and either it's made by the board that's operating the exchange, or else the legislature will have to revisit it.
Okay. So unfortunately, we're out of time. However, is there a second meeting that we know that is
Nope.
going to be taking place yet? No date. Okay. When there is one, I would like you gentlemen to come back and chat with us about it, because obviously this is a sticky wicket. We're talking about something very difficult
so.
here, healthcare policy, and it's going to impact a lot of people in New York and nationally. So, Neil, thank you very much, and Russ, thanks for
Thank
being
you
here,
very much.
and we'll have
Pleasure.
you back.